Hello friends, welcome to my channel. I am Dr. Himanshu Gupta and in this video we are going to revise head and neck. So let us begin our discussion. First you will identify the various foramens in the head and neck and you will tell the structures passing through the foramen. You identify the foramens that I am marking. You should know these foramens by heart. So think, what are these foramens and what are the structures passing through these foramens. So take your time. Now friends, I will tell you the answers. This is optic canal. This is superior orbital fissure. This is foramen ovale, foramen spinosum, and this is foramen rotundum. You can remember it with the mnemonic ROS: rotundum, ovale, spinosum. They all lie in one line. This is foramen lacerum. This is internal acoustic meatus, jugular foramen, hypoglossal canal. This is foramen magnum. Now we will discuss the structures passing through the foramen ovale. Structures passing through foramen ovale are mnemonic is male. Mandibular nerve, accessory meningeal artery, lesser petrosal nerve. E is for emissary veins. Structures passing through foramen spinosum, the mnemonic is men. Middle meningeal artery, emissary vein, and nervus spinosus. Nervus spinosus is a meningeal branch of mandibular nerve. Now structures passing through foramen rotundum is maxillary nerve. Structures passing through the internal acoustic meatus is facial nerve and vestibulocochlear nerve. You have to remember the arrangement of the facial nerve, cochlear nerve in the internal acoustic meatus. So this is anterior, this is posterior, this is facial nerve, this is cochlear nerve, this is superior division of vestibular nerve, and this inferior division of vestibular nerve. You can remember it with the mnemonic 7 up, coke down. 7 up, coke down. From the jugular foramen, the structures passing through the anterior part is inferior petrosal sinus. From the posterior part is sigmoid sinus, and from the middle part it is 9th, 10th, and 11th nerve. In the foramen lacerum, you will see internal carotid artery. In the carotid canal, you will see carotid artery. In the hypoglossal canal, you will see the hypoglossal nerve. So this was all about the foramens. Now we will see the structures passing through the superior orbital fissure. Structures passing through the medial part is, structure passing through the ring is, and through the lateral part is. Think the answers in your front. Lateral part is LFT, lacrimal nerve, frontal nerve, trochlear nerve. Through the middle part is superior division of trochlear nerve, superior division of oculomotor nerve, inferior division of oculomotor nerve, abducens nerve, and nasociliary nerve. And through the medial part it is inferior ophthalmic vein, inferior ophthalmic vein, inferior ophthalmic vein. Superior ophthalmic vein passes through the lateral part of the superior orbital fissure. Now I will tell you the triangles of the neck. Triangles of the neck. This is posterior triangle of the neck. Posterior triangle of the neck. It is bounded anteriorly by sternocleidomastoid muscle. Sternocleidomastoid muscle. Posteriorly by trapezius muscle, and its floor is formed by splenius capitis, levator scapulae, scalenus anterior, and middle scalene. This triangle that is bounded posteriorly by sternocleidomastoid, anteriorly by posterior belly of digastric, and inferiorly by superior belly of omohyoid is carotid triangle. Carotid triangle. And the triangle that is bounded superiorly by mandible, and inferiorly by digastric muscle, is digastric triangle. So this was all about the triangles. Now we will discuss the structures that form the main component of the posterior triangle. You will see the greater auricular nerve, lesser occipital nerve, spinal accessory nerve, third and fourth cervical nerve, dorsal scapular nerve, which is a branch of brachial plexus, and it supplies rhomboids, major and minor. And you will also see one nerve that is traveling over scalenus anterior. This is phrenic nerve. These are the major structures: greater auricular nerve, lesser occipital nerve, spinal accessory nerve. Spinal accessory nerve supplies sternocleidomastoid and trapezius. Greater auricular nerves provide sensory supply to the scalp. Lesser occipital also supplies sensory nerve supply of the scalp. This triangle that we see is carotid triangle. In carotid triangle you will see the carotid vessels that form the major part. So this was in brief about the posterior triangle. Posterior triangle is further divided into an occipital part and an subclavian part. In subclavian part you will see the subclavian vessels. You will see the trunks of the brachial plexus. Friends, let us discuss the various muscles. As you see, this is the trapezius muscle. It causes shrugging of shoulders. It takes part in shrugging of shoulders, and it takes part in abduction of shoulder also. Abduction of shoulder beyond 90 degrees. This is sternocleidomastoid. We have discussed the muscles of the base of the head and of the posterior triangle. And now this is the hyoid bone, and the muscles below the hyoid bone are called infrahyoid muscles. These are superior thyrohyoid muscle. As the name suggests, it starts from thyroid and it attaches to hyoid bone. The muscle below the thyroid and attaching to the sternum is sternothyroid. This is sternothyroid. Then we see the omohyoid muscle, and most medially we see the sternohyoid muscle. So basically there are four muscles: sternohyoid, superior belly of omohyoid, thyrohyoid, and sternothyroid. Friends, I will give you one diagram of ansa cervicalis. Ansa cervicalis, it is formed by ventral ramus of C1 and hypoglossal nerve and C2, C3, C4. So the ventral ramus of C1 and hypoglossal nerve gives nerve supply to, what is the answer, friends? It gives nerve supply to genioglossus and thyrohyoid, and rest of the muscles are supplied by infrahyoid muscles are supplied by C2, C3, C4, like sternothyroid, sternohyoid, and omohyoid. We call this is as ansa cervicalis. Omohyoid. So this was in brief about, and here you can also see the muscles of the tongue. This is digastric muscle. As you see the attachment of these muscles, the muscles below the hyoid will cause depression of hyoid, and the muscles above the hyoid, like digastric, stylohyoid muscle, posterior belly of digastric, they will raise the hyoid bone. Okay, friends. So the muscle coming from the hyoid bone and attaching to the mandible is mylohyoid muscle, and just posterior to the mylohyoid and deep to it is the hyoglossus muscle. Friends, this video will give you just an overview of the head and neck so that it is easier to read your anatomy. So friends, this was about muscles. Now you have seen the contents of the posterior triangle also. Now some questions on the external carotid artery. Friends, you will tell me the medial branch of external carotid artery, anterior branches, posterior branches of external carotid artery, and the terminal branches. Think the answer, and now I will discuss with you the answers. The only medial branch of external carotid artery is ascending pharyngeal artery. You see here the ascending pharyngeal artery. And the posterior branches are posterior auricular artery, occipital artery. The anterior branches are facial artery, lingual artery, that is going deep to the mylohyoid muscle, and the terminal branches are maxillary artery and superficial temporal artery. Superficial temporal artery. So I will again tell you the branches. The branches of terminal branches are maxillary artery and superficial temporal artery. The posterior branches are external carotid artery and posterior auricular artery and occipital artery. The medial branch is ascending pharyngeal artery, and the anterior branches are facial artery, lingual artery, and I missed one branch, that is superior thyroid artery. Superior thyroid artery. Superior thyroid artery. So this was about external carotid artery. Now I will tell you about internal carotid artery. Internal carotid artery has a cervical part, a petrous part, a cavernous part, and a cerebral part. Terminally, the cervical artery divides into an anterior cerebral artery and middle cerebral artery. Anterior cerebral artery and middle cerebral artery. So some branches that I want you to know that are branches of internal carotid artery, which we always confuse, is that anterior choroidal artery. Anterior choroidal artery is a branch of internal carotid. Then posterior communicating artery. Posterior communicating artery. This is also a branch of internal carotid. And ophthalmic artery. Okay, friends. So let us discuss some few more branches, one-liners. Pica is a branch of. Pica is a branch of. It is a branch of vertebral artery. Vertebral artery. This is a very important question. Posterior inferior cerebral artery is a branch of vertebral artery. And how is basilar artery is formed? Basilar artery is formed by joining of two vertebral arteries. Two vertebral arteries join to form basilar artery. Now friends, let us discuss the subclavian artery. Subclavian artery. What are the branches of subclavian artery? The branches of subclavian artery are, you can remember it with the mnemonic vitamin CD. Vitamin CD, where V stands for vertebral artery, I stands for internal thoracic artery. Internal thoracic artery. Internal thoracic artery. This is vertebral artery. T stands for thyrocervical trunk. C stands for costocervical trunk. Costocervical trunk. And D stands for dorsal scapular artery. Dorsal scapular artery. So the further branches of thyrocervical trunk are, as you see, thyro means thyroid. It will be supplying one artery to thyroid, and it is inferior thyroid artery. Inferior thyroid artery. Cervical means costocervical trunk. Cos 2 means like it will be giving transverse cervical artery, transverse cervical artery, transverse cervical artery. And one more branch that is coming from thyrocervical trunk is suprascapular artery, suprascapular artery. Suprascapular artery. So these are the branches of the thyrocervical trunk: inferior thyroid artery, transverse cervical artery, and suprascapular artery. The superior thyroid artery is a direct branch of external carotid artery. Friends, let us revise the veins of the thyroid also. Superior thyroid vein drains into, superior thyroid vein drains into, inferior thyroid vein drains into, and middle thyroid vein drains into. Superior thyroid vein drains into internal jugular vein. Middle thyroid vein drains into internal jugular vein. And inferior thyroid vein drains into brachiocephalic vein. Brachiocephalic vein. These are important questions that you need to know. Now friends, we will discuss few questions about cavernous sinus. Cavernous sinus. In cavernous sinus, you need to do structures in the lateral part of the cavernous sinus. What are the structures in the lateral part? These are third nerve, fourth nerve, ophthalmic nerve, and maxillary nerve. Mandibular nerve lies outside the cavernous sinus. Mandibular nerve lies outside the cavernous sinus. This one is the nerve just adjacent to the internal carotid artery is abducens nerve. Abducens nerve. Abducens nerve. Friends, hope you know which muscle does abducens supply. The mnemonic is LR6. LR6. Sixth nerve supplies lateral rectus muscle. LR6 SO4. The trochlear nerve supplies superior oblique muscle. Trochlear nerve, which is the fourth nerve, supplies superior oblique muscles. Rest muscles are supplied by third nerve. Third nerve. Okay, friends. So now we will discuss the tributaries of the cavernous sinus. It is the tributaries from the orbit are superior ophthalmic vein, inferior ophthalmic vein, central vein of retina. From the meninges, it is sphenoparietal sinus and middle meningeal vein. Sphenoparietal sinus and middle meningeal vein. And from the brain, it is superficial middle cerebral vein and inferior cerebral vein. Superficial middle cerebral vein and an inferior cerebral vein. And through the meschery veins that we discussed in foramen and ovale, remember the mnemonic male and men. The E stands for meschery veins. They connect it to the pterygoid plexus of veins, which connect it to the facial vein. And this cavernous sinus drains into transverse sinus through the superior petrosal sinus, inferior petrosal sinus into the jugular vein, jugular bulb. Okay, friends. So this was in brief about cavernous sinus anatomy. Now we will discuss the various afferent, efferent nuclei, general somatic efferent, special visceral efferent, general visceral efferent. So what are the nuclei that form general visceral efferent? General visceral efferent. General visceral efferent is supplied by general visceral efferent supplies all the glands. So the glands which we know are lacrimal glands, then parotid gland, sublingual gland, submandibular and sublingual gland, and abdominal viscera, glands of the abdominal viscera. And one more component of general visceral efferent is sphincter pupillae. So the nerves which supplies these glands are sphincter pupillae is through Edinger-Westphal nucleus, which is the nucleus of third nerve. Lacrimal glands, palatal glands, and nasal glands. These are supplied by seventh nerve nucleus, that is lacrimatary nucleus. Parotid gland is supplied by ninth nerve, and its nucleus is inferior salivatory nucleus, and it is a nucleus of ninth nerve. And submandibular and sublingual glands are supplied by seventh nerve, by the superior salivatory nucleus. And the abdominal and thorax viscera are supplied by dorsal nucleus of vagus. So I will again tell you the ganglions which these nucleus form. Inferior salivatory nucleus goes to otic ganglion through lesser petrosal nerve, and otic ganglion lies on mandibular nerve, to be specific, auriculotemporal nerve. Submandibular glands are supplied by cauda tympani nerve, branch of facial nerve, and it goes to submandibular ganglion. The lacrimal glands, palatal glands, and nasal glands are supplied by the pterygopalatine ganglion. And sphincter pupillae is supplied by Edinger-Westphal nucleus through the third nerve by ciliary ganglion. So in brief, we have discussed about the ganglions also. General somatic efferent, which supplies the muscles derived from the somites. These are third nerve, oculomotor nerve, trochlear nerve, sixth nerve, abducens, and 12th nerve. In special visceral efferent, these are the muscles derived from the pharyngeal arches. muscles derived from the pharyngeal arteries. Its components are fifth nerve, seventh nerve. Fifth nerve forms first pharyngeal arc, seventh forms second, and 9, 10, and 11th nerve. These are together called nucleus ambiguous. Nucleus ambiguous. From M, you can remember it is motor. So these are the muscles of the pharyngeal arches. So as you know, like tensor tympani palatini. Tensor tympani is derived from first pharyngeal arch. Tensor tympani is derived from first pharyngeal arch. It also supplies muscles of mastication. Muscles of mastication. What are the muscles of mastication? Muscles of mastication include temporalis, masseteric, lateral pterygoid, and medial pterygoid. So these all muscles of mastication are supplied by mandibular nerve, which is a part of fifth nerve. Mandibular nerve we will discuss in detail. Seventh nerve supplies, as you have learnt, like stylohyoid muscle is supplied by seventh nerve because it is a component of second pharyngeal arch. And nucleus ambiguous supplies muscles of the soft larynx and pharynx. Muscles of larynx through internal laryngeal nerve and external laryngeal nerve. Muscles of the pharynx and soft palate. All muscles of soft palates are supplied by nucleus ambiguous except tensor villi palatini. Which is supplied by fifth nerve. Now friends, we will discuss the various afferent nucleus. General visceral afferent nucleus. General visceral afferent nucleus will carry the general sensations from the tongue and includes nucleus of tractus solitarius. It will carry sensation from the tongue, pharynx, carotid body, pharynx, larynx, trachea, esophagus. The pharynx is supplied by ninth nerve, and larynx, as you know, is supplied by 10th nerve or laryngeal nerves. If you remember, the part above the vocal cords is supplied by internal laryngeal nerve, and part below the vocal cords is supplied by recurrent laryngeal nerve, which are branches of vagus. And the posterior part of the tongue is supplied by glossopharyngeal. Special visceral afferent nucleus. It means taste sensations. You can remember it with the taste sensations. Taste sensation from the posterior part of the tongue is carried by glossopharyngeal nerve. From the anterior part of the tongue, it is through anterior 2/3 part of the tongue is through facial nerve. And in general somatic afferent, you get the sensations of the in general somatic afferent, you get pain and temperature sensations, the proprioception from the face, and you know the face sensations are carried by fifth nerve. So fifth nerve has various nuclei: spinal nucleus of trigeminal, which carries pain and temperature; main sensory nucleus, which carries fine touch from the face; and mesencephalic nucleus, which carries proprioception. From the face. And special somatic afferent is found by eighth nerve and second nerve, which carry the hearing and vision sensations. Now friends, I will discuss with you the mandibular nerve. From the main trunk of mandibular nerve, you get the nerve to medial pterygoid and nervus spinosus, which is a meningeal branch of mandibular nerve passing through foramen spinosum. Okay, and then it divides into an anterior division and posterior division. Anterior division basically gives nerve supply to the muscles of mastication, the mesenteric nerve, the deep temporal nerves, and the nerve to lateral pterygoid. What is the function of lateral pterygoid, friends? Lateral pterygoid causes depression and protrusion of mandible. And medial pterygoid causes protrusion of mandible, and it lifts the mandible. The branch to the medial pterygoid comes from the trunk of the mandible, from the trunk of the mandibular nerve. Okay friends, so now we will discuss the branches coming from the posterior division. From the posterior division we get auriculotemporal nerve, which supplies sensory supply of the scalp, and in the two heads of the auriculotemporal nerve lies the otic ganglion, supplies parotid gland, and it further gives lingual nerve and inferior alveolar nerve. Inferior alveolar nerve further gives the branch to nerve to mylohyoid muscle, which also supplies to the anterior belly of digastric muscle. Okay friends, now we will discuss, this was in brief about mandibular nerve, facial nerve. We will discuss the important branches. The first branch from the geniculate ganglion is greater petrosal nerve. Greater petrosal nerve goes to pterygopalatine ganglion, as we have discussed earlier. Pterygopalatine ganglion, and it supplies lacrimal glands, nasal glands, and palatal glands. And when we get injury to greater petrosal nerve, there will be dry eyes. Second branch is nerve to stapedius, which supplies stapedius muscle in the middle ear. And when there is injury to this at this level, then there the stapedial reflex is lost. Third branch is cauda tympani nerve carries taste sensations from the anterior two-third of the tongue. Anterior two-third of the tongue Okay friends, and it comes out through the base of the skull, and it gives branches to the various muscles of the face. Okay friends, so here you see the greater petrosal nerve, the nerve to stapedius, the cauda tympani nerve, and it comes out through the base of the skull, and it divides into temporal branch, mandibular, cervical, buccal branch. And now we will discuss the various structures passing through the superior constrictor and inferior constrictor, between superior and middle and inferior, and base of the skull and superior constrictor. The structures passing through the base of the skull and superior constrictor is levator balli palatini, eustachian tube, and ascending pharyngeal artery. The structures passing between the superior and middle constrictor is stylopharyngeus muscle and glossopharyngeal nerve. The structures passing between the middle and inferior constrictor is internal laryngeal nerve and superior laryngeal artery. And the structure passing beneath the inferior constrictor is recurrent laryngeal nerve and inferior laryngeal vessels. Okay friends, so this was in brief about head and neck. Hope you enjoyed the video. Thank you friends.